Wow, this talk with Dr. Josef from the Alpstein Clinic in Switzerland just twisted and turned and went so many places. It just flowed. Yes, we started with tonsils. We started with dental technology and language, and it went way into our immune systems and how our immune system works, and how the most important person on our team is just that, it's team, that we are the most important person on our team, and why and how we can be engaged in our own healthcare. Wow, this is an exciting episode. Dr. Josef never disappoints. Directly from Switzerland, enjoy Dr. Josef here on The Beats. Welcome back to The Beats. I have a very good friend and colleague here today from Switzerland, all the way from the Alpstein Clinic. Dr. Joe is here. He is a board certified dentist and medical doctor, but he primarily works as the dentist there at the Alpstein Clinic. They always strive for health and excellence at the Alpstein Clinic, which is why we so enjoy being educated by you, by sending our clients there. We just love the Alpstein Clinic, and we thank you so much for your time with us, Dr. Joe, because we want to get some clarity and the dental piece for all of our listeners today. So thank you for being with us.
Well, thank you, Kelly. It's an honor, as always, being part of your great team and a great inspiration for us to be able to represent our knowledge towards our American listeners and towards the American people. I know you had a hard time. It was election time, probably the most sophisticated Hollywood story or Hollywood show in the world. But if the year comes to an end, the new year starts, new dynamics, and we keep our fingers crossed, and we'll support you from far away, no matter what. So,
well, thank you for that.
Let's get going.
I want to say that one of the things we talked about before we got on the podcast today was that clinics like ours and you guys do a lot more obviously at your clinic because you have an actual clinic. We have a center, you have a clinic where you can do medical procedures, but you have done some changes. You've incorporated some things that are new to keep on the cutting edge as always, but also in light of what's going on for people, to help give them a little boost for their immune system, a little boost for their own ability to manage whatever's going on for their immune system. But because you've created such a unique combination of the medical and the dental clinic together, you've really kept not only going through coronavirus, but thriving. And that speaks not only to the medicine, but to your whole team and what your team has put out there and continues to put out there to get the greatest care for people, the most comprehensive care for people, and to give people the most ability to control their own health, which is the best part for me of what we do with European biological medicine. But can you talk about that? I want to go into some of the language of dentistry today for our listeners, because I think it's important for them to talk about that. But before we do, let's just talk a little bit about the IVs that you're doing there at the clinic, just to give people a little sense of why we continue to study in Europe and Switzerland, and why we call our friends and colleagues in Switzerland our constant educators, because you guys are always cutting edge and always doing things that are years ahead, light years ahead of some of the knowledge here in the States. So explain a little bit about the IV.
Absolutely. I think to say that also in America we've seen great clinics like yours, which is sort of like introduced and merged European knowledge or like biological knowledge from all around the world into your own health system. So I think on one hand, you can be really proud about that. On the other hand, we're very fortunate. So we're in this little county, which is probably the size of Manhattan, and by state regulation and by the Swiss medics, we're allowed to use the most important components that we consider being biologically active. So we're very fortunate that way, that we're not limited in what we're allowed to give, besides obviously the sensitive topic of stem cells and so on. But on the other hand, also, mixing conventional remedies with biological or being purely biological, we have a free limit to do what we like to do. So we really appreciate that, and we're quite fond of it. And at the end of the day, whatever we're able to achieve, it's an honor for us to pass it on to our patients when it's about detoxing, when it's about regeneration and healing. Yeah, IVs. I mean, IVs. Most people probably know from emergency rooms. Either you had a hangover, then you're gonna go and get like a Myers cocktail. For the young people who like doing that, and then most of us, when they have a health issue, they get some saline infusions. They're gonna get some glucose infusions, and obviously, a lot of people know about antibiotics, but that's like the pure conventional approach, which at that time probably has a proper indication and use. And I mean, what we like to do really is to separate the infusions according to diagnostic groups. So we see a lot of patients, coming in with general neurological issues, with autoimmune disorders, with the metabolic issues, with the precancer state, with chronic systemic infections, and with our diagnostical tools and individualized treatment approaches, it's quite convenient to be able to sort of like shift our or put our infusion programs into these kind of like blocks. I think it's easier to explain it that way than to speak about what's inside. But at the end of the day, having the proper diagnostics, being able to know, okay, what is really the cause making us sick, leading to high blood pressure, leading to Lyme's disease, leading to Parkinson's or Alzheimer's, all these kind of like diagnostical symptoms that we have. Well, all these symptoms that we're given, there's an underlying cause, and we build up our infusions on the causes. So we always try to address the part of the body, which is most symptomatic from the disease, and we try to take this as a benefit and combine, plant-based or phytotherapeutic remedies with hemopathic remedies, with vitamins, minerals, with sulfhydrolic compound agents, which are really good for the liver one and of phase 1 and phase 2 of liver detoxification. Glutathione is like a super important substance. So I think on this scale, we're very fortunate again to be able to offer for our patients the best approach according to their individual needs.
Well,
Yeah.
the IVs in Switzerland, to give somebody an idea, right now in the United States for the last, I don't know, 2 to 3 years, we've had these IV centers
Right.
pop up everywhere where somebody can
Okay.
walk in and almost like ordering a coffee, walk in
Yeah.
and go, I would like my V with this much vitamin C, this much ALA, this much vitamin B, blah, blah, blah. And
Right.
that's good. It's got vitamins and minerals. And we won't talk about the fact the majority of the vitamin C they get is from genetically modified ingredients, that most of those IV suites aren't really
Yeah.
caring about the quality of what they're putting in your veins. But what they do in Switzerland even more is just, okay, yeah, we're going to give you some Myers cocktail, we'll give you some minerals, but in addition to that, we're going to create some homeopathic specific to what you're dealing with, specific to your autoimmune, to specific to the causes for what your body's symptomology is dumping into this diagnosis. And so it's a customized IV that might have not only nutrients in it, but also going to have some other homeopathics in it for information, going to have some elements like glutathione is what he just mentioned, which is something
Yeah.
the liver creates that helps your detoxification pathways. Some other like it's like the substrates, the ingredients your body needs to make the cake, and the cake is
Yeah, it's like precursors, we like to call them.
precursors to
Yeah.
the detoxification pathways, precursors to the minerals that your body can detoxify, precursors
Yeah.
to vitamins to allow your body to just make all the processes work. But there's a specific IV that y'all have done in the last 2 months. I think it came out in November when you really started doing it. And that's a little bit of a different IV. How is that one different? The pheresis IV.
Oh, I mean the pheresis IV. Yeah, I mean, I think really with the plasmapheresis that we're fortunate to have introduced from November is really like taking out venous blood, pushing the venous blood through specific filters, which is able to separate the plasma, so sort of like the plasma fluid from the general blood. And the plasma is a very strong carrier of substances that are quite active, and these active substances or these active products, unfortunately, can be highly intoxicated due to the high turnover with organic or inorganic toxins. So we really push that through different filters, which sort of like works like a diffusion. And to really support this diffusion, again, we like to give the combination of vitamin C, B vitamins, which play an important role in cell function and cell regeneration, but also something that we call like the Zitronensäurezyklus. It's like the citric acid cyclus, which is part of the
Oh,
um, yeah, it's
Krebs cycle.
yeah,
The Krebs cycle
exactly, Krebs
for
cycle.
so it's
Yeah,
vitamin C and the everything that gets your body to create the battery basically for your cells,
yeah.
the energy
So
source for your
So
cells.
really, the combination of the vitamins of the Krebs cycle substances that you can get in form of like a hemopathic administration, ATP, which is very very strong power generation substance, also ubiquinone, which is a very good coenzyme and an antioxidative product. We all put this together into a combination. So it's really a combination of three complex infusions. One is specifically to the most important vitamins, mainly vitamin C and all the B vitamins. The other one really combines ATP, ubiquinone. Well, correct me if I mispronounce it.
Okay.
And the Krebs cycle. And the third one is like a really good dosage of glutathione once again, because with glutathione we have a very powerful agent that during this plasmapheresis filtration, really, is being given back with the clean plasma and the remaining blood into the body, and immediately acting on the most important regenerative and detoxing pathways. Yeah.
And so essentially this IV allows your body to filter out the crap and keep all the good stuff to make it very plainly, simply understood. Which when I read about it the first time and when we talked about it just a few minutes ago,
Yeah.
my instant reaction was, so basically the IV is helping your lymph system because your lymph system is its filter, is your body's filter. And if your body lymph isn't working or the lymph is taxed from our lifestyle or exposures, then it doesn't work as well. And maybe we can be a little more vulnerable to viruses. And so this is a way to boost our own immune system as work our lymphatics, but you're doing it with plasmapheresis in an IV, which is just another way to create a terrain, an environment to let those cells be happier in which they're living in, correct?
Yeah, absolutely.
I'm wrong. Correct me where I'm wrong.
Yeah, no. I mean, that's what it's about at the end of the day. Our body works a lot. We have the venous system, we have the lymphatic system, we have the arterial system, but most importantly, really, everything that goes into the cell and is supposed to come out of the cell and comes out, that's a breakdown product, and the breakdown products have to clear the body. And obviously, if there's somewhere an inflammation, local inflammation or systemic inflammation, you create congestion, and this congestion creates a onward cascade of additional blockages. So wherever there's a congestion, the tissue around it will also develop a congestion at some stage. So really, the idea of infusion, especially specific infusion with the combination of plasmapheresis, is there to sort of like relieve the congestion that we have in our blood circulating system, which contains between 6 to 7 liters of blood volume. And that's sort of like, it's said in a stupid way, but that's like the juice coming out. And generally, that is supposed to be clean, but or supposed to have some breakdown products from cell metabolism pathways. But I mean, we live in an environment, and we shouldn't be ashamed of it, where we have much more like external influencing factors or toxins, which we have to challenge on a daily basis. We eat, we drink, we breathe, we travel a lot. We have a lifestyle which is much more, complex than it has been 20, 30, 40 years ago. And
Right.
from that point of view, again, the load that we take in and the burden that we have is going to be much higher. So it's really like, cleaning out the fueling system or the fueling lines, and giving back, a better quality of blood without toxins, which can make us sick. Yeah.
Right. And so let's just jump to the tonsils for a second because it makes me think
Yeah.
of tonsils. Because the tonsils, I've always learned that the tonsils are the gatekeepers to the lymphatic system. And, in Europe is where I learned all about the lymphatic system and the importance of it and resolving cases and helping people detoxify is only as important as their drainage. And the tonsils, for me, I had always been taught like if there's a blockade in the healing to work with the tonsils, and we started talking about that. Let's just jump back to that conversation. So
Right.
why would that be? Why, that wasn't something you had necessarily heard, and that's the conversation I'm
Yeah.
having. Well, I've never really heard that. I'm like, well, that's kind of what I know, and what the evidence we've seen in our center is that we have a doctor down the street that we send a lot of clients to inject a lot of tonsils. We put people on a lot of tonsil drainage remedies. We have them manually pump their tonsils and work their termini and their tonsils or their lymph, because this is I'm touching my neck for those that are listening. This area seems so darn important to me from looking at my CRTs throughout the years where I split out the head and the body. From your perspective as a dentist and a medical doctor, but as the dentist, the overseeing medical director dentist at the Alpstein Clinic, what is your perspective on the tonsils and the lymphatics and this whole oral area?
Well, I mean, that's a very, very good point, which is not being addressed a lot nowadays. And I think, the time will come when people will, or where the medical community will focus much more on, importance of lymphatics. I mean, to put it in easy words, it's like, it's like your Avengers, it's like your SWAT team. At the end of the day, not to forget, when we speak about tonsils, so tonsils is a part of the oral mucosal system. And when we eat and drink, I mean, the first defensive barrier that we have is the oral area. And from that point of view, the different types of tonsils that we can find, in our throat, in our palatum, or in our pharynx, these are like medical terms. And quite interestingly, again, as I'm saying, just the area of the head and neck, that's like the most important connective line that we have between our central nervous system and the rest of our body. So all the impulses traveling from the center to the periphery will have to cross the head and neck area. And the head and neck area is a quite open system. Again, you breathe, you eat, you listen. And from that point of view, it's an entry portal for the most important, nutritions or life forms that we need to survive, whether it's air, whether it's food, or whether it's fluid. And the body, it has developed over millions of years, or in the human development, systems which are more focused on immune protection and lymphatic activity in those areas where we have the first entry point. Yeah, and also in those areas where you have a much more complex communication between important body systems like the central nervous system, or like the heart, or like the lungs. So I think the location and really the external factors, influencing the area, make the area of the oral cavity, or also the tonsils and the lymphatics, super highly important. Some people say that 80%, 85% of all the communication that we have in form of neurological neural pathways, blood flow, arterial blood flow, venous blood flow, lymphatics, energetic information travel between head and body, has to cross the mouth area. And from that point of view, yeah, I mean, this is probably one of the most complex and sophisticated area that we can find, with the highest diversity in lymphatics and lymph nodes, or in lymph structures. I mean, a disease in the oral cavity can have a severe outcome. I mean, there are conditions from dental point of view which can be precancerous or even cancerous. Probably most people know about oral floor cancer, or mouth cancer, which is one of the most devastating, tumors besides a malignant melanoma. It's just because of the location and the aggressivity that's given, and because the blood flow and the lymphatics is so complex and so dynamic in the area. This is why it's so important to address, be good about prevention, about healing methods, but also, when there's a disease or a specific symptom coming up, to act quickly, to be able to use the advantage.
I feel like I just got kicked
System.
in the gut when you're saying this story, because I feel like I have to tell my brother-in-law's story.
Okay.
My brother-in-law had not gone to the dentist in 20 years. That was just not
Right.
his lifestyle. And by the time he went to the dentist, he went to a local dentist here in Pennsylvania. They pulled 6 teeth. Within
Right.
6 weeks, he ended up getting what started off as a little pimple behind his ear grew to the size of a tennis ball. By the time they took him to the University of Pennsylvania, they put him in a 15-hour surgery. They took out his parotid gland, and they took 59 lymph nodes from his head and neck.
Yeah.
Thank God then he went to the Paracelsus Clinic 5 weeks later and spent 5 weeks at the Paracelsus Clinic. This is like 10 years ago now. And he lived for 3 years. He stopped getting his mistletoe. He stopped doing his treatments. And of course, he passed within a few months. But it seemingly happened so fast because he didn't take care of his mouth. And when he went to have his teeth cleaned, and they pulled 6 more teeth at the Paracelsus Clinic from the pure rotting, they said that the plaque was actually holding a lot of his teeth in place. And it was like, he was 44 when he passed. So this happened when he was like 41, 42 years old. And he had a certain lifestyle. He was a tattoo artist that stayed up all night, living a certain lifestyle. But reality was, from the outside, he looked pretty healthy. He was a young guy. He was very active. And man, I won't say he got the cancer overnight, because he didn't. His lifestyle was conducive. But the minute they pulled that out and took all those lymph nodes, it was like his body couldn't do anything else. And the Indiba helped, and different therapies we did helped prolong. But the lack of drainage from everything up in his head, he had so many fillings. It was ridiculous. I don't remember, like 10 or 15 silver amalgam fillings. But, the head and neck is so key. I remember when I was a young girl, my uncle got throat cancer. He was a smoker, and it was like he got throat cancer, and then all of a sudden he had the trach, and that was it. He never spoke again except through that voice box. And my father had 7 different types of cancer, never of the head and throat. He had some lymph node cancer in his neck, and that was like 4 years before he died. And that's where he had the stroke, was right on his neck, where they had taken a bunch of lymph nodes and they had done a skin graft. And I've never really thought about it, Dr. Joe, but as you're talking about it, I'm like, I've talked about the tonsils for years, but here it goes fast. The communication
exactly.
is the key of why it moves so fast in that area, and why the tonsils, the gatekeepers to the lymph, as I've called them for years, are so key with all of our dental care. Because if we're not cleaning out what's coming in, it's not coming out. It's going to stay in. It's going to affect our central nervous, our peripheral nervous system, and our autonomic nervous system.
Yeah, and also, what people sometimes don't consider is that really, the digestion starts with the upper lips. So whatever you eat and drink, it goes into an environment where you have normally millions and millions of healthy bacteria, really like building the biofilm, what we like to call it. And from the digestion really starts from up here down there. So whatever, might be like an inflammatory impulse or like a trigger coming from the oral cavity, you swallow. And when you swallow, the entire digestive tract from the mouth to the bottom will be affected in the same way. So for us, really, tonsils is being part of the digestive tract, to put it in a way, also besides being an important like immune avenger, like the great American Avengers. Yeah, I mean, I don't know how to put it in different terms, but so lymphs are good. I mean, it's important to have them. I mean, that's without lymphs, I mean, we're not able to really challenge, invaders and toxins. So
yeah. Well, in all honesty, and we'll get to the dental verbiage in a minute, and for me, that's what this coronavirus that we're living in right now in 2020 as we end here. But I have never felt a stitch of fear since this coronavirus thing started. And it's because of the information I've gathered and what I've done with my body over the last 10, 20 years before that, and
Right.
knowing about the lymphatic system, that I sat there and was like, okay, I'll just keep working my lymph. I'll do my flow prezos. I'll do my flow prezos. I'll do my flow prezos, and we'll be fine. And I've worked harder and longer in the last 9 months than I've ever worked in 30 years. And I feel great. I have no issues whatsoever. I've done a couple IVs, prophylactically, because I like
Yeah.
IVs. I love glutathione. I get as much as possible. I've had my tonsils injected by Dr. Schaffner a couple times. Like, I love getting that therapy. But the reason I do all that is because I want my lymph to be as healthy as possible. And I feel like in America, the lymph system isn't really talked about. Is it talked about in Europe and Switzerland? Like, do the average person know what the lymphatic system there, or is it more of a failure of our system, our health system?
No, I think it's more like the training of the conventional system. But
Okay.
when you really look into like a whole body approach, or you try to put in elements out of the biological or the evidence-based biological methods and therapies, then it's always an important part of it.
Yeah.
Yeah, I mean, it's being taught as like, oh my God, I mean, your thymus is important, your spleen is important when you're a kid. The development of T or B lymphocytes, this is all super important. But then, with the age of like 25, 26, the function starts decreasing. But again, it's being really pushed aside. But at the end of the day, it's like, having a car or having an engine, but you pull, the gear shift out of the engine, and then it's not going to run. So I think even in Europe, in a conventional approach, lymphatics is being like addressed as a part of like, oh, let's do some lymph therapy, let's do some lymph drainage and massage, instead of like, okay, really look at the lymphatics at the cells, so where they're sitting, and what we can do to improve their function or keep their function as active as it has been, in from the day one when we're born. This is why, much more, severe chronic diseases only develop with elder people of the age, 30, 35 going upwards, because in that age, the lymphatic activity is decreasing just by a physiological aging process. So, I mean, when you draw a line,
And more sedentary the older we
yeah, I mean, when you draw a line and you compare like, okay, diseases and my lymphatic activity, it's like, lymphatic activity is high, diseases are low. Obviously, there are some lymphatic diseases, leukemia, or being part of blood and so on. But those are like 1 to 2%. But really, if the lymphatics are high up and working well, then the risk of chronic systemic diseases is quite low. And the opposite goes for, if you have a lot of chronic systemic diseases and you just check for the lymphatic pathways and for inflammatory signs, you will see that the lymphatics are not working properly.
That's a really good point. I never thought about that inversion relationship, but they have a completely inverted relationship, disease and lymph. If you have a lot of,
Yeah, I mean,
I feel like the broken record, honestly. Like, everybody says to me, I did a podcast a couple of weeks ago, and the woman said to me, I feel like lymph has become the 4-letter F word now, because every time I talk to somebody, I just want to say it's lymph. And I'm like, I get it. I've been feeling like that for 10 years, but before, middle, and after a case, you need lymph care.
yeah, I mean, it's the same with teeth. It's
Right.
you have to
Dental care.
brush your teeth. You have to care for your teeth. You have to go for cleaning to have a good foundation, which can stay stable and healthy for 40, 50 years of your life. And the same goes for lymphatics. The same goes for it's a stupid comparison, but going to a hairdresser, going to a pedicure or manicure, it's a similar thinking and idea. Okay, keep it healthy, do more prevention than acute treatment, which takes more time and is more expensive.
So
Yeah.
proper dental care for most people is getting their teeth cleaned not once a year, but 2 times a year, correct?
I mean, the most studies, state that when you grow up, or when you go to school and kindergarten, and then elementary school and high school, university, go twice a year for cleaning and checkup, and brush properly at home, and then you'll be fine for the rest of your life. It's like, whatever we have, we're not a sterilized system, so we're a very, very diversified system. with probably the most complex symbiosis that you can find on planet. I mean, we have more foreign cells in us than human cells, and but still we managed over years or thousands of years to develop a sort of like a symbiosis where we live together. But this needs to be nourished, this needs to be cared for in a way that the harmony stays. If the harmony doesn't stay, does not stay, then obviously diseases like dysbiosis, decay formation or caries formation, periodontological diseases, digestive tract disorders, so will start developing. Yeah.
Well, just in knowing, like I have a 7-year-old, and so the way he brushes his teeth, the way I brush my teeth, two different ways, right?
Right.
So brushing my teeth is important, but how I brush my teeth, how long I brush my teeth, the how hard or soft, like I was told for years I brush my teeth too hard, and now
Yeah.
I'm using the electronic toothbrush, which definitely allows me to brush without that aggressiveness, but be able to get my gum line. I
Yeah.
also, brushing the tongue is important. My son brought this up. We were traveling recently. We had to stay at a hotel. He couldn't stand it. He went in to brush his teeth. He came out. I was like, Mom, I can't brush my teeth. Water's so gross. We have well water at our house. So
Yeah.
people are brushing their teeth in chlorinated water with all the chemicals. That makes a difference. So we use bottled water that day to brush our teeth. It's not just but it's also the toothpaste we use. The mouthwash we don't use because most of the mouthwashes are gross. The floss that we use, which is
Mm,
coconut, like all these things
yeah,
matter.
absolutely.
Hard pressed to find floss without fluoride
Yeah.
already added to it,
Mm,
and so I want people to take awareness of that and look at your toothpaste. Silas was doing a commercial, not really a commercial, but he we ran out of toothpaste. I grabbed the tube. I took it home. On the back of the box, he took my phone and did a little commercial for the creator of the toothpaste, Dr. Caratola, because literally
right.
you can eat the toothpaste.
Yeah.
And I never realized it before, but I never really read the box because I know the creator and I know what he put in it. But it was kind of amazing to see that on a box of toothpaste. You can eat this. Like I've never, you see that every time it says do not eat this, call poison control if you do. Now
Mm,
his toothpaste says to do it. So these are all things that we want to be mindful of so that we don't end up with an amalgam filling or any kind of any filling. And it's not just the amalgams that are so sinister. There's also the white fillings are not always good. Some of them are made with BPAs, correct?
yeah, I mean, unfortunately, it is very true what you're saying. I mean, there's a strong like controversy about like, okay, amalgam is devil's product, and composite fillings or resin compound fillings is the product of an angel. Well, not really. I mean, again, I think we always have to see the pros and cons, but nowadays we know that most substances they react with the environment. I mean, we're a living unit, we're a living structure, and whatever we put in us will react with us because we're having blood circulation, we're having lymphatics that we talk about, we're having processes, we're having bacteria living with us, and it's just how it is. So it is very important to know, okay, which kind of filling materials I'm supposed to use for the specific indication, for the specific case. So, obviously we know nowadays that amalgam, especially if they contain or implement, mercury, that's probably the worst kind of like filling material that you can apply if you have a patient who's very hypersensitive, who has a very difficult detoxification system, who has a very weak metabolic rate, and who has a high, genetic or epigenetic, preload, we call it. And then obviously then there's a dilemma. Okay, well, what are we going to do? I mean, okay, great. I'm going to grab like a white filling material. So if amalgam is bad, I'm going to use resin compound or composite, plastic fillings, and then everything is solved. No, it's not that simple. I mean, also those have additives, also those have solvents, also those are made up out of three different, components, inorganic, organic particles, and sort of like a binder that you need to combine everything. And yeah, and most people nowadays, who had amalgam, they're happy that, oh, great, I can finally detox, but then they decide to get resin compounds fillings. with the wrong indication, and then they develop hypersensitivity, they develop skin rash, they develop, dermatological and allergic reactions. They they have a very bad, like enzymatic function afterwards, bad thyroid gland function, adrenal gland function, because a lot of times, resin compound fillings, if they're made quickly and cheap, then you will have those particles or additives inside, which which are rather, bad for your health than well, positive for your health. So I mean, BPA is that's just like the cherry on the cake. But what about the MMA? I mean, PMMAs. That those are the long chain metacrylatic substances which have a very high allergenic and cancerogenic activity. What about those? I mean, nowadays, if you really want to go for good filling material, and you say, okay, I'm not going to use amalgam, I want to use a resin compound material. You have on the market products where the filling material is 10 times more expensive compared to the average. And if you look what's the difference, yeah, I mean, you will see the difference in quality and in the allergenic or non-allergenic component or potency. And from that point of view, yeah, I mean, it's super important for every patient to pick the right choice, to do the right choice. Yeah.
So it's about being conscious, about knowing what's in your mouth. I mean, I'm fortunate, honestly. I've not had a lot of dental work. I've had a couple little fillings,
Right.
and I've had them remediated with a biological dentist. I had a couple root canal or not root canals, wisdom teeth
Okay.
removed, and
Right.
they turned into cavitations, and I've had the cavitational surgery.
Right.
But I'm fortunate. A lot of people that call us, and I do these initial phone consults with, I ask them questions, and a lot of people don't know. And honestly, when I started this work, I didn't know what a cap was versus a crown
Yep.
versus a bridge. I don't know what any of this was. But the first thing I would say to everybody listening is be involved and engage in your own care. If you don't know what somebody's putting in or on your body, be informed, have informed consent. It's not an emergency, correct me if I'm wrong, Dr. Joe, to be able to do whatever dental procedure needs to be done today. Get the information, come back and get it done when you know better, when you are in alignment with what they're doing and you know what they're doing. And so that when you leave the dentist, you know what the work was done and what the care for that work.
Yeah.
If you have a bridge that comes in and out, how do you care for that? If you have a flipper tooth, if you have an implant, how long is it going to last? A lot of people in our area, they have the option to go to one of our dentists that does porcelain or
Yep.
ceramic fillings. And
Yep.
I'm always like, yeah, go do those. Well, they might not last as long. They're more expensive. Yep.
Yeah.
The cost to everything, but you got to look
Yeah.
at the whole picture and understand that. So can you explain what a bridge is versus I don't know, a bridge versus something else that might be in the mouth, but explain what
Yeah.
a bridge is.
Yeah, I mean, I think also an important point before I go into that topic is that, nowadays in 2020, we can honestly say that, great medicine or great dentistry or great whole body approach is always a teamwork effort. So, don't be afraid, don't be silent. I mean, you have to approach your caring physician or dentist and say, look, I mean, I have this issue and I want to have a solution. What can you offer me? And at the end of the day, for every concern, there will be a solution, but the better the team works together, the better the outcome. So I think this is something, which wasn't lived so much 10, 20, or 30 years ago, but nowadays you should live it. And you will find, same-minded physicians or dentists who think the same way. And
Yeah.
this will guarantee the best outcome for you, giving you the best information and detail about everything that you're asking for. Yeah, I mean, when you speak about bridges, speaking about the actual topic, bridges is just a term of replacing teeth with a fixed solution. I mean, we really always speak about, bridges or dentures or implants. And then, we really say, look, if a tooth has to be extracted or if a tooth is missing and, your bites is off and you feel that, you're missing teeth, then there are two ways to replace teeth. It's either with a removable solution or with a fixed solution. Removable, most of us know that as being a denture. They're the old school, like metal framework dentures, which look quite, shabby or, quite uncomfortable to wear.
Yeah.
And then again, nowadays, also in 2020, you have great possibilities to do it metal free, or to do it out of a substance which has like a chameleon effect. So when you have it in your mouth, it adjusts to your gum and to your teeth structure. So it's much more comfortable to wear. When you take it out, it hardens again. So, and then those can be transparent, those can be gum colored. So people cannot differentiate, and it's much more comfortable to wear. Same goes for bridges. I mean, if people say, look, I have a denture, but I don't like the denture to being so bulky, to be so big, to cover my gum. I can't taste the food. It's always moving around because it's removable. Then you have to go for a fixed solution. And fixed solution is done with a bridge or with an implant, to be honest. There are also some, like fixed reversible dentures, but that's more like a midline solution. But if you really say, look, I want to go with a fixed solution, I want to stabilize my bite, I want to, give the best chewing possibility, I want to chew soft, hard, gummy. If you like Dylan's candy bar, which every dentist loves, then you probably want to have a fixed solution. um, and it's very also important to understand that a stable bite is important for the craniomandibular posture. It's
So
also important.
I want to reiterate what he just said. So the bite is so key to your cranial mandibular posture, which has to do with your head and your jaw. And your head and your jaw and how it sits has a lot to do with your low back and back problems and your
Exactly.
shoulders and your feet and your knees and everything below. If your head is not put on right, and if your bite isn't right, if your teeth don't touch in the back when you're laying down, if they don't touch when you chew in the front, and they don't in a certain way occlude or bite down in a certain way, your whole posture and your whole body's off, and your whole autonomic nervous system is off. That is so key for people to understand,
Absolutely.
because they think that bites and dentistry is about the cosmetic look, and we couldn't be farther from the truth in a biological setting. It's all about the functionality. They are looking for a functional bite. They are looking for your teeth to touch in the front and the back, so that your parasympathetic and your sympathetic nervous system are properly supported as you literally move throughout your life. And please add to that what you will, Dr. Joe, but that's so key what you just said.
Yeah, I mean, I'm absolutely with you on that topic. And another important thing, lymphatics only flow if your bite is stable. So if your bite collides or collapses and you go into deep bite, or you have like a malocclusion, or you have a asymmetrical bite, then obviously the lymphatics will become congested, so they won't work properly. So for the whole body and system to work, to flow, and to have a inflammatory free, or like congested free connection between head and the body, the bite needs to be great. The bite needs to be stabilized, and it needs to work in a proper way. Otherwise, the congestion or the collapse in the bite causes decreased function in the lymphatics, decreased function in the venous, reflow. And especially during nights, during night times when we sleep, it's quite important to know. So every collapse in the bite, whether it's artificially made or made by us with grinding or clinching, for example, this always compresses all the vessels that bring the important, nutrition or blood to the brain, but also takes away, the venous blood and the lymphatics coming out of the brain to the rest of the body. So at the end of the day, this is why we always say, if we really compare, removable to fixed solutions, to fixed dental solutions, it's much better to go for a fixed solution like a bridge and implant, because this allows a proper lymphatic flow, to put it that way.
And I so appreciate you
Mm.
bringing it up, because you know that that's one of the quote unquote specialties that I've delved into, or found myself in. But I work on a lot of people's jaw and a lot of people's bite from a
Yeah.
muscular, a fascial
Yeah.
perspective, because I realize that that forward head posture, which I struggle with myself, I'm a constant work in progress, but the forward head posture from sitting in at chairs, but also the clenching. And I've noticed, I have two dental friends in the United States that have noticed an increase in both their practices from people clenching their teeth since
Yeah.
coronavirus. And so that's one of the reasons that I've been more adamant about getting flow presos out
Exactly.
there. because it puts people in that parasympathetic state. It helps
Yeah.
them relax. They relax their jaw. When they relax their jaw, their flow can happen better through your head and neck. And that is a key for me. Like, you got to keep this open. You got to stop clench. No, you don't have to do anything. You can do whatever you want. There's no shoulds in life. It'd be really great if you're listening to this, however, and you find yourself clenching a lot, to learn how to loosen that so that you get better drainage, because you'll have better toxins out by just lessening your clench. But that also might tell you there might be a reason for that clench. Your bite might be off. The bite might be off. That can cause a lot of the clench. You know,
Yeah.
the egg, there's always that.
Yeah.
But this is a key component. We haven't gotten past the neck yet in talking about
Yeah.
all this, but and implants in talking about, you know, brushing your teeth. Implants is a very broad subject too. You have titanium implants, you have zirconium implants,
Yeah.
you have a one-piece implant, you have a two-piece implant. So there's a lot of information about implants. So know about your
Absolutely.
implants and know what kind is best for you. Sometimes titanium implants are going to be the better
Yeah.
solution. Not always, but sometimes. There are no black and white rules. It's all gray.
Yeah. I mean, you know, I always like to say, independent what you use, you know, it will be a foreign body. And for every genetic constitution, or for every human being, there is a best solution. And nowadays we're fortunate because you can test it. You know, can know in advance, okay, which material should I take, which fits better for me. There will be always down and upsides, but at least nowadays you can test and make sure that the downsides are less and that you have more benefits with what you use. But I think I absolutely agree with you. I mean, there is no black and white. At the end of the day, you know, whatever you put in the human body has to learn to live with it. And I think from that point of view, whatever stresses less the immune system, whatever has a less tendency to cause inflammation or spreading of inflammatory processes, is the right thing to go. Yeah, I
And
absolutely agree.
I've said to some clients, like I had somebody in here last night that her boyfriend was starting to get his amalgams out with a standard dentist. And I literally
Right.
said to her, tell him to please stop. I'd rather him keep them in his mouth than have them drilled out from a non-biological dentist that's not taking precautions, that's going to make him sicker quicker. I've seen it a lot.
Mm,
And so it's not always true that you need to go get your amalgams out. You can get your amalgams out if your body's ready and if you have a skilled, proficient dentist that's going to do it in the proper way. Otherwise, it's better to leave them in. That's my experience. Correct me if I'm wrong, but that's my experience. It's not always wise to go in and do 4 cavitational surgeries in one sitting. It's not always wise to get you've got to treat every single person as an individual, just as they are, and at where they're at in their life, and step through the process with them with what's best for them. You know, cone beams have become the new gold
yeah.
standard, which is great, but it doesn't mean that panos and FMXs
Yeah.
aren't good anymore, correct?
Yeah, absolutely. I think also there, you know, I mean, still FMXs and panos are the best, you know, like control scans that you can do. But if there's like a specific concern, especially when we talk about root canal treated teeth and failing root canal treatments, having ongoing symptoms even after root canal treatment, then sometimes really for very specific indications, it's very sensible to do CBCT, which can, you know, be like sort of the solution to understand why you have problems. So I absolutely agree on that. Yeah, yeah,
So I think the point is that we want everybody to understand, be engaged with your dental care, know what's going on, get some information, know that there's no one perfect test out there, get the different parts of the test that are right for what you're doing, and be engaged and informed and proper care. So what are your big two, I don't know, I'm putting you on the spot, but what are your big top 2 or 3 um, like processes or treatments or self-cares that people can do that you find that they're not doing, which would give them a huge boost in their immune system for their dental?
yeah. I think really the interdental hygiene. That's what a lot of people, you know, don't find the time to do,
Which
which
is
is
flossing,
understandable. Yeah, I mean,
their dental.
flossing, using interdental tape or interdental floss, using interdental brushes, you
Uh-huh.
know, sticks. I think this is something, you know, on a daily basis. If you brush, don't forget doing it. because by doing it, you're able to remove much more plaque, much more debris, which at the end of the day, if you don't remove, can cause decay, can cause periodontological issues. And that's always the constant. I mean, this is what the studies show. If you're able to, brush twice a day, try to use a soft toothbrush if you have a sensitive gum, if you have a sensitive bone structure, if you're more fragile. Try to use a ultrasonic toothbrush compared to a manual toothbrush, and floss on a daily basis. See your dentist once or twice a year for checkup, and then discuss together what kind of preventive measures you can take, which will be less cost
Long-term
expensive.
cost. It might be
Yeah, I mean, which
upfront, for long-term, it'll cost you less.
yeah, exactly. I mean, at that moment, you might have to pay more out of the pocket, but looking at 10, 20 years, you will save much more money. And I think on this point of view, today, everything is about, being a team, being together, finding the best solution for your own type, I mean, for your own personal needs, and be preventive and be minimal invasive. I mean, this is the modern, whole body approach. And yeah, that's, I think, what you should care for. And then obviously, again, the mouth is part of the digestive tract. So consider when you have, unhealthy gum, or when you have decay, this will trigger, inflammation in your gut system. So one leads to the other. Everything is linked together. Yeah.
Yeah, because it's the same mucosa. I say this a lot, but
Yeah, absolutely.
I want people to
Absolutely.
hear it. The same mucosa that's in my mouth is in my nose, in my lungs, and my gut. It's a shared mucosa.
Yeah,
And if one is like, we do a lot of nasotherapies and nebulizers,
exactly.
can't do injections here. So I'll do that, or I have them go out to the hydrocolon therapist. But the bottom line is I'm trying to clean up from here to here and clean up all that mucosa in the middle, so that the mucosa is supported, so that the lymphatics can flow. And that's after the dental influence and the scars have been therapized, so that the body's working as ideally as possible, letting those toxins come out. And then we deal with the whatever emotions and orthomoleculars we need to. But this is where we learn this from. The dentist is the most important person on your team. I appreciate that Dr. Joe here is telling you that we all work in a team, and we do. But if I was sent to a desert island and I could only take one practitioner with me, it would be a dentist, because they can affect every single tooth in my mouth. And we had our son at a dentist this week to fill two little kind of cavities in those buckles in his back molars before they became real cavities. So we're just filling them, but he's got an upper lip tie that needs addressed. And we were going to do it in that sitting. But because my son was exposed, like he got explained what was going to happen, he got a little emotional. The dentist did the right thing and said, we're not going to do it today till you're ready. And I thought that was the best thing ever for a 7-year-old, to feel some control over his healthcare, to go, yeah, I'm going to get this done, but not today, because you told me it was going to hurt like a scrape on my elbow, and I don't like that. So we're going to wait. We're going to do these today. We're going to build some trust. And this dentist said to my son, it made me cry. It'll probably make me cry again. Silas, don't you ever let anybody touch your body or do anything to your body of a person whom you don't trust. And if that's the takeaway, that's the most important thing we can ever give to our bodies, is don't let anybody do something to you that you don't trust or that you don't understand, for that matter. My 7-year-old wanted to understand what was happening that day. He wanted to understand what was going to happen in the future. And yet I have clients that call me that are in their 40s, 50s, 60s, doesn't matter. And I say, what's going on in your mouth? They're like, I don't know. Well, did you have a root canal? I don't know. Maybe. I think so. I kind of remember that. Well, you should know what's going on in your mouth. Please be engaged with it. Know what's going in there. Know the implants. Know your dentist. Have a plan with your dentist. Work with your dentist, just like your doctor. They are part of your team, and you should understand what they are doing with you, for you, and so that they teach you how to prevent further situations in the future. We spent a lot of time talking to Silas about how to care for his mouth to make sure he didn't get any more cavities on those back 2 molars. So, I don't know.
I mean, it's really, a stupid comparison I like to do is like everything is linked together. So, when you mentioned the issue with COVID, most people say, okay, I have COVID, I will have pneumonia. But when we look at the different studies, I mean, most people, who have COVID, they have lung issues, but they have digestive tract issues, and they have smell issues. So when we speak about the same mucosa, the same organ, it's understandable that lung and digestion, or even the smell, it's all coming from one system. This is why this is where you will find the most common symptoms arising from. So I mean, this is just an example explaining that our body is connected all through. So
Yeah, that's
yeah.
perfect. Well, thank you so much. You can see why we like to have the Alpstein doctors as our guests, because they're a wealth of information and really tangible information that you can take action today. Go and clean in between the teeth. Make sure we're cleaning that bacteria up. Thank you so much, Dr. Josef, for the work.
Well, thank you. Thank you so much. Thank you, Kelly. I mean, it's always an honor for me, happy to be a part of the American Dream Team.
Oh, well, I look forward to hugging you soon and being in Switzerland or having you here for a class or something soon. And getting our multi.
We'll work something out.
Yes.
Yeah.
Thank you so much.
Thank you.
Make sure
all the best.
Thank you. You too. Make sure to hit the subscribe button, hit the notification so you know when we're going to be on the Beats next, sharing with you the details of how your body actually works.
Thank you.